Have you ever bled while you're brushing your teeth? What was your first thought? Should I visit my dentist? If that was your reaction, you are in the right steps to prevent major problems that can approach you in the future. But what does bleeding gums mean? How do you stop this bleeding? How does this affect your teeth? Bleeding gums, by definition, is gum disease, also known as periodontal disease. Periodontal disease is an inflammation caused by bacteria that grows in the mouth, around the teeth, and along the gum line. Unfortunately, this preventable disease can cause loss of the teeth if it's not treated. Despite being preventable, gingivitis is quite common. An estimated 3 out of 4 American adults have gingivitis, the earliest stage of gum disease. Patients that do not treat gingivitis are starting in a painful and expensive journey that can last for months, years, or the rest of their life. There are 4 stages for the gum disease. Gingivitis is the first stage of gum disease, and its symptoms include inflamed or red gums that may bleed when brushed, possible bad breath or bad taste. Early periodontitis is the second stage. A slight loss of bone that support the teeth occur even though symptoms may not easily observed. Pockets from 3 to 4 millimeters start forming in some areas. The bleeding and the plaque buildup increase around the teeth and under the gums. Moderate periodontitis is the third stage. More bone and gum tissue are destroyed, and losing of the teeth may also occur, especially on the front teeth that start drifting. Gum boils and abscesses may develop, and pockets are between 4 to 6 millimeters deep. Advanced periodontitis is the last stage of the disease. Symptoms becomes more severe. Teeth can become more loose. Biting and chewing may hurt. Root may be exposed and very sensitive to hot and cold. Pockets between gums and teeth now are excess of 6 millimeters deep. Extensive dental treatment needs to be required to correct the damage that the gum disease. Gum disease have different treatments depending on the stage. Gingivitis is treated with a professional prophylaxis every 6 months. Maintenance at home is very important. Brush your teeth 2 times a day and floss 1. Full mouth debridement will be the right treatment for the earliest stage of periodontal disease. It might be performed using instruments like ultrasonic device. For moderate periodontitis, it's necessary to perform a scaling and replaning. Now, the hygienist needs to go deeper and smooth the root surface. Gum surgery and extraction will be performed by the periodontal doctor at the last and advanced stage of periodontitis. These treatments are very painful and expensive. In conclusion, this very common disease affects more than 3 million of people in US. Older adults, African, Hispanics, current smokers, and those with low income and low education are more prone to have periodontal disease. 8.5% of adults between 20 to 64 suffer from this condition, and 5% have moderate or severe periodontitis. As you see, something so simple like brushing and flossing every day and a visit to your doctor twice a year can prevent that you suffer from this common disease. Give to the world a healthy smile. Thank you.